Many thanks for choosing us. Let's begin with the COVID-19 pandemic, because Volta, Bono and Bono East regions are emerging as COVID-19 hotspots in the country. The case rise in these regions since July has been significant. Director of the Ghana Health Service, Dr. Patrick Koma-Boaje, who gave an update on the country's case counts at a briefing, mentioned, for instance, the Volta region, which had only 16 active cases as at 1st July, now has 532. Most of these cases were recorded in schools.
The current situation is that as at the 1st of August, we have confirmed a total of 106,434 cases. And I'll give you the further analysis of that. And that the total tests done is 1,449 million tests. There were 98,814 recoveries, and we have so far recorded 854 deaths. And you can see that we started this problem with about 817. So you can see how far, how many people have done. Our current active case is 6,766. And this is quite worrying. So as that tells us that in the last few weeks, we have increased, our active cases are increased from 1,600, that's in the last 1 month, to 6,000, to over 6,000 in 1 month. There's been a very steep rise in the active cases in the last 2 weeks. We have increasing hospitalization and deaths. We are having some emerging hotspots outside Accra and Kumasi that we know of. That is now, we have Volta having new cases. Bono and Bono East also sharing some cases. We also have workplace and school outbreaks taking place. The general hotspots still remain as we speak today. Accra is deeper, then followed by Ashanti region. And then you have the other regions. Now we're seeing Volta, color is getting deeper. Eastern, Central are also showing increasing number of cases. When we come to Volta region, we've seen a lot of few more schools there getting outbreak. That is also influencing the numbers they are getting. If you look at our active cases, you can see that the chart there is quite steep now. Very steep. The last second we peaked at about 8,000. And if nothing is done urgently, in the next 1 or so week, we might just cross the 8,000 mark. So there's a lot that we all need to do to avert this. This has also shown in our hospitalization. Currently, just in Greater Accra alone, we have 272 persons on admission because of COVID. 36 of them are critical. Severe cases are 87, and about 149 are mild to moderate. There are all this, you can see that there's a steep increase in the number of critical cases, making it difficult for the case management team and affecting our ability to provide ICU beds for the teeming number of people who currently
is warning of a very steep increase in the numbers of critical and severe cases if the low adherence to safety protocols continue.
We also have seen, as all of you are aware, that still there's a total disregard to the use of the face mask by the general population. And unfortunately, the Delta variant has become the main dominant variant currently as we speak now, especially in Greater Accra region, where we've done extensive work. The next slide. So you can see that from the curve that you are seeing, the third wave is on its way up, and we hope that we will work, and all of us, not just the health sector, including the people, will be able to avert this by applying the protocols and adhering to all the protocols, including acceptance of contact tracing, cooperating with contact tracing and isolation, so that we can bring these numbers down. And we, all of us, not just the health sector, including the people, will be able to avert this by applying the protocols and adhering to all the protocols, including acceptance of contact tracing, cooperating with contact tracing and isolation, so that we can bring these numbers down. So if you look at the 7-day moving average in the next slide, you can see a steep rise. In the second wave, we are very approaching where we peaked in the second wave. But there's an opportunity for us to work very hard to start reversing this by simply applying the very protocol that has worked for us over the years, over the months, the first and the second wave, to be able to bring this down.
And now joining me for more on this is Dr. Senenu Jokoto. He's Deputy Volta Regional Director of Health in charge of Public Health. I'm grateful for your time this afternoon. Dr. Jokoto, Volta Region, which had 16 active cases as of July 1, now has 532. What happened?
Thank you very much. A very good afternoon to all your listeners. It is an issue of concern for us to have moved from 16 cases to 532 cases in just 4 weeks. And this largely has been influenced by, let me say, 4 main factors. Anytime we have an upsurge in Greater Accra region and the Ashanti region, usually because of the interconnectivity between the region and these regions, eventually we get cases also here in the Volta region. Same was replicated in the first and the second wave. The second factor has been the suboptimal adherence to protocols, safety protocols, especially wearing of masks properly. It is something that has not been the best at all. And usually people ascribe reasons as complacency, people getting fatigued with doing the same things and still being told there's COVID, so they should continue doing it. And then, like the rest of the country, we also have very low vaccination rates. We are hoping that when the vaccines also come in, majority of the population in the Volta region would also have it, and this would also help. And from the genomic sequencing that has also been done at the University of Health and Allied Sciences, we have also come to the realization that this current outbreak is fueled by the Delta variant. So these are the 4 main factors that have driven our case count from 16 to 532 active cases in the past 4 weeks.
Now, Dr. Jokoto, health officials in the Volta region, I'm sure, are extremely worried about this development, coupled with the fact that these cases are recorded from the schools.
To say worry might not be the accurate description, because we are drawing on the experiences that we have acquired from the past 1.5 years. And we also know that we have an enhanced capacity to respond to infectious diseases. We still enjoy a lot of cooperation from all the stakeholders within the Volta region, from the Regional Public Health Emergency Management Committee and all the religious organizations and so on and so forth. And we also have guidance from the and support from the National Response Team. So this is a challenge that we have before us. And like I said, we are going to draw on these strengths to be able to overcome the current upsurge in cases that we are seeing. What we ask is that the general public comes on board and supports us. We would continue to engage them. We know that they are fatigued. We know that some of them want to give up, but this is certainly not a time to give up. We still have a long way to go in controlling this particular pandemic in the schools as well. As soon as we hear that, or we find out that it's an outbreak in any institution, we have response mechanisms in place. Usually for schools, if it's a tertiary institutions, we let them revert to online lectures. Those who have infections are isolated. Those who have to be quarantined are also quarantined. And then we enhance adherence to protocols within those institutions. And usually, within 2 to 3 weeks, we are able to avert the outbreak in those institutions. Luckily, most of the cases have been mild, and with quite a number of them even being asymptomatic. So as much as possible, we take those who are at risk, those who have comorbidities, those who are aged within those institutions. We make sure that we take them out so that the risk of them suffering, getting the infection and suffering from severe disease is eliminated. And so these and many other measures have made it possible for us to deal with some of these institutional infections. But like you said, it's cause for concern, and we have to continue to enforce the safety protocols, especially.
And I'm happy that you talk about drawing examples from other regions. And of course, having noted that adherence to the protocol has been a challenge in the Greater Accra and Kumasi, for instance, how differently is the region intending to face this kind of development?
I do not intend to preempt the Regional Public Health Emergency Management Committee's decisions. But what I know is that in the coming days, most likely we are going to see a lot more enforcement. We have been speaking to the public about the risk that they face, and I would like to use this opportunity to also thank the media, especially, who have been very supportive. But we still notice that some people are still not adhering to the protocols. Whilst commending those who have been adhering to the protocols, I would want to once again appeal to all those who live in the Volta region and are coming to the Volta region to please adhere to the safety protocols. We do not want to get to the point where enforcement would be the mainstay when it comes to adherence to protocols. We want people out of their own will and understanding of the situation to be able to adhere to the protocols. But certainly, enforcement is something that is on the table and that is being considered.
Dr. Senanu, I want to thank you so much for your time this afternoon. Dr. Senanu Jokoto, he is the Deputy Volta Regional Director of Health in charge of public health.